All right, ladies and gentlemen, this is going to be your medical assessment skill station for your National Registry. We're going to give you a basic rundown of how this skill should proceed throughout your medical assessment, and it is going to be primarily focused on that National Registry skill sheet that you have. It should give you a basic idea of how to actually assess a patient in the field as well, and then hopefully you've already looked at this sheet, you memorized it, and you know all that critical criteria, because that's going to be what fails you on this station, most likely. When you walk into this skill station, they're going to give you a little spiel, kind of tell you you have 2 professional partners, 15 minutes to do it, kind of just a rundown of how the skill is going to go, what you have, and what you need to do. The main key when you're doing this skill is that you tell that examiner every thought that crosses your mind. You really need to verbalize everything that you think, just due to the simple fact that that examiner is not going to know what you're thinking if you don't tell them. So, that being said, once all that's done, knocked out of the way, you need to check your equipment, make sure you have your appropriate equipment. Right here we have a variety of different things. Main things you're going to need are your blood pressure cuff and stethoscope, as well as a pen light, a possible glucometer, O2, any type of drugs that you may be approved to give through your SOPs, and then any extra equipment that you may need, such as in your Thomas pack or in your Medic or anything like that. You'll also need your PPE, which will be gloves and safety glasses for this skill station. So, you've gone ahead and checked your equipment. Your examiner should give you a scenario for you to follow through and talk about and assess your patient on. And what's our scenario?
65-year-old male sitting on the tailgate complaining of severe chest pains.
Okay, so we have a 65-year-old male that happens to be sitting on a tailgate complaining of chest pains. At this time, we'll go ahead and get started. We'll take our appropriate BSI, which would be gloves and safety glasses. We'll check to make sure our scene is safe before we approach our scene. As we come up to our scene, we're going to want to go ahead and possibly request additional ALS unit, just because it's chest pain is possibly cardiac related, so we would like to have somebody close by. If they can meet us en route, that's great. If not, then we'll proceed on to a cardiac cath lab. We're also going to want to note the number of patients that we have, which should just be 1 sitting on a tailgate. And then our nature of illness is going to be cardiac chest pain. We'd go ahead and consider C-spine, but due to the nature of illness being cardiac related and no trauma noted in our dispatch information, we're going to assume that his C-spine's okay until we come in contact with him and are able to ask him. Notice our patient's general impression. Kind of a poor general impression. He's slightly slumped over at this time. Appears to slightly be in some kind of distress. So now we're going to actually go up and talk to our patient. Hey sir, my name's Josh. I'll be your EMT for today. Can you tell me what's going on?
It's just having chest pains.
Okay, so we noticed a couple things. He was able to speak to us pretty clearly, so we note that he has a good open patent airway. We've also got his chief complaint, which would be chest pains. And then we also note that he is alert and verbally responsive to us. So, and we know that because he saw us when we came in and recognized us. All right, so we know he's got an open airway. We can go ahead and assume, since he's got no airway problems at this time, most likely he's not gonna, but we're gonna keep an eye on that just in case. He's not speaking in a raspy tone or anything like that either. So now we're gonna go ahead and assess his respiratory rate and circulation. So right now, just checking a pulse. What does my pulse feel like?
94 and 30.
I don't appear to have any major breathing at this time. So I have a pulse rate of 94 and 30. My breathing is currently
16 times a minute.
16 times a minute. What's my quality look like? Do I have good equal clear bilateral chest rise and fall?
You do.
Okay. We're going to go ahead and assess those lung sounds as well, just to make sure that they're okay. Apex, apex, base, base, and then we can do it on the front side. Apex, apex, base, and base. What do my lung sounds like?
Clear.
So So I currently have clear lung sounds, respiratory rate about 16 a minute. He's getting good, equal bilateral chest rise and fall. I can assume his airway and his breathing are okay at this time, but I'd like to go ahead and place him on 15 liters of high flow oxygen due to the fact that he's having chest pain, and that's possibly got something to do with the fact that he's not getting enough oxygen to his heart. So we'll consider that done. What does my patient's skin color and temp look like?
Pale, cool, and moist.
Okay. I noticed that it does appear to be slightly shocky, so we'd go ahead and treat for shock. We've got him on 15 liters of high flow oxygen. We'd want to go ahead and lay him supine, and then we'd want to keep him covered throughout our assessment to kind of keep in that heat. We're going to make the decision that he's a high priority transport due to the fact that he's having some type of cardiac related emergency most likely, as well as the fact that he's showing signs of shock right now. So at this time, we're going to go ahead, get him en route to the hospital, take anything that we need to take with him, load him up on the stretcher, get en route, and start our secondary assessment. So can you tell me when this chest pain started today?
About 10 minutes before you got here.
That's my time. 10 minutes ago before we got here. Onset, what were you doing when this came on?
Working out in the yard, shoveling dirt.
So he was working out in the yard shoveling dirt for his onset. Does anything make it better or worse?
Resting makes it a little bit better.
Provocation. What does it feel like to you, quality?
Kind of a like crushing.
So you have a crushing chest pain started 10 minutes ago, and you were outside working when it came on. And rest does make it feel better. Okay. At this time, on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, what does it feel? What are you rated as?
About a 5.
All right, so your severity is about a 5. Do you have any medical problems?
History of angina and a heart attack a year ago.
History of angina and a heart attack a year ago. So we do have some cardiac problems. At this time, we're definitely going to want to take him to a cardiac cath lab just to be on the safe side, especially if we can't meet ALS en route somewhere. Are you allergic to anything?
No, sir.
Not that you know of. And do you have any medications?
I am prescribed a nitro.
Nitro? Have you taken any of your nitro today?
I took it 2.
You've taken 2? When was that?
Before I called.
Okay. Are you taking any other medicines at this time?
No.
Is there any possibility you were bit or stung by anything while you were out in the yard that you could be or come in contact with anything you're allergic to?
No.
No? Okay. What was the last thing that you had to eat?
Breakfast, which was basic essentials, eggs, bacon, toast, and coffee.
Okay. And then you were shoveling dirt when this came on, and you went inside and rested. Did it get a little bit better with that rest, or did you have to take the nitro to make it feel better?
A little bit of both.
A little bit of both? Okay. We're en route to the hospital. If we can meet our ALS unit before we get to the cath lab, we'd like to go ahead and do that because we'd like to be able to see what kind of rhythm he has. But now, we're going to go ahead and get a set of vital signs on him. Which is a skill you'll actually have to perform in your National Registry. Make sure my cuff is in the right place. It's going down the artery. Make sure my stethoscope ears are in the right place. And my positioning is good. All right. What's my blood pressure?
140 over 80.
All right. Go ahead and check for a pulse. What's my pulse?
Still 94.
Still 94. And my current respirations?
Still 16.
Still 16. Has that oxygen helped you any at all yet, sir?
A little bit.
A little bit. Okay. And do we have an O2 saturation available?
O2 is at 92.
Okay. 92%?
Yes, sir.
All right, so he's at 92 at 15 liters. So we're doing the best we can to oxygenate him. He's got a good ventilatory rate going, as well as equal bilateral chest rise and fall. Let's go ahead and take a listen to those lung sounds again. Do I still have good lung sounds?
You do?
So I currently have good lung sounds, and my skin color and temperature again are
Still pale, cool, and moist.
Okay, so we're still going to maintain our treatment for shock, high flow oxygen, laying supine, and cover him with a blanket. At this time, we're going to go ahead and treat him. We're going to go ahead and call Med Control to treat him with his nitro. Since he's already given 2, I want to make sure and confirm with Med Control that it's okay to give him another one and possibly give more en route to the hospital depending on how far we are. As well as I'm going to go ahead and try and get orders to give him 325 of aspirin. So Med Control comes back and says that's okay. Give 325 aspirin, and you have orders to give 3 doses en route to the hospital. However, we'll end up being about 5 minutes away, so we'll probably only have time to give 1. So sir, take this aspirin, please chew it up and swallow it. All right, patient takes that aspirin, chews it up and swallow it. And then now I'm going to assist him with using his personal nitro. One time, sir, can you raise your tongue up? All right, raise your tongue up, squirt it in your mouth, close your mouth for me. All right, take that back, place it over there. We'll go ahead and start our reassessment. We're going to reassess him every 5 minutes due to the fact that it's cardiac related, so we want to make sure to watch those trends really closely in our vital signs. So we go ahead and get another set of vital signs as well as another set of OPQ-RST. At this time, we're about 5 minutes from the hospital, so we'd like to go ahead and call patient report. And our patient report would just consist of a 65-year-old male that was complaining of chest pain. He has a history of angina and a heart attack about a year ago. He took 2 nitro prior to our arrival, and since then we've given him 1 nitro plus 325 of aspirin. He's on 100% oxygen, being treated for shock right now as well because he appears to be cool, clammy, and pale. Last set of vital signs were currently 140/80, pulse rate 94, O2 sat was 92, and respirations were 16. And then we're about 5 minutes away from your facility. Do you have any questions? If your facility has no questions, you would be done with your skill station. Thank you for watching this video. We appreciate it. If you have any comments, please leave them below.